Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's get into a bit of a medical detective story today. Our case, it doesn't start with a crime scene, but with a really puzzling discovery made during an autopsy. We're talking about clues hidden deep inside the brain that point to a silent stroke, one that happened 5 years earlier. So let's piece this whole mystery together. So this is really the central question, isn't it? How can something so small, just a few tiny fluid-filled cavities, tell us exactly what happened to a patient and why it happened years after she seemed to have recovered? This is the mystery we're going to solve.
Okay, here's our first major clue. This comes from the autopsy of a 61-year-old woman. Now, she actually died of a heart attack, but for us, the real story is hidden in these tiny little holes. And believe me, these are not just random findings, they're like little scars marking the scene of a very specific event from her past.
To solve this puzzle, we've got to work backward from the evidence, These little cavities, they're the key that's going to unlock the entire story of her illness. So our first step is to figure out what they are. And just like that, our investigation has a name. For these cavities, we've officially identified our primary evidence. These are healed lacunar infarcts. So now, let's dig into what that actually means, and more importantly, how they even form in the first place. So the official term for one of these little holes is a lacune. It's actually Latin for pool or pit, which makes perfect sense. It's basically the healed scar left behind after a super specific, tiny little stroke called a lacunar infarct. You can almost think of it as the ghost of a stroke. Now, what's really fascinating here is just how specific these strokes are. First off, they're tiny. We're talking less than 15 millimeters. They're what we call ischemic, which just means they're caused by a blockage, not a bleed. And, this is the critical part, they happen way deep inside the brain, in places like the thalamus or the basal ganglia. Why? Because a single tiny little artery gets clogged up. So you're probably wondering, how does this hole even form? Well, after that little bit of brain tissue dies from the lack of blood, the body's cleanup crew, these amazing cells called macrophages, they come in and just clear away all the dead debris. The process is called liquefactive necrosis. And what's left behind isn't a scar like you'd get on your skin, but actually an empty space that just fills up with cerebrospinal fluid. And that creates the tiny, clear puddle the pathologist found. Okay, so we know what happened. A tiny stroke healed and left behind a little cavity. But the big question is why? Why did it happen? So now we're moving to the next phase of our investigation. We need to identify the underlying disease, the real culprit behind this stroke. This right here is a perfect illustration of the scene of the crime. We're looking deep inside the brain at these incredibly small arteries that branch off the main highway, which is the middle cerebral artery. These little guys are called the lenticulostriate arteries, and they're basically ground zero for this entire problem. And here we have it, our prime suspect. It's a condition called lipohyalinosis. Yeah, it's a mouthful, I know, but all it really means is that the walls of these tiny arteries get thick, weak, and hard over many years. And what causes it? Well, two of the most common chronic conditions out there, high blood pressure and diabetes. And guess what? Our patient had both. So let's walk through how this happens, because it's a slow, sneaky process. It starts with chronic high blood pressure, damaging that delicate inner lining of the artery. This lets proteins leak into the vessel wall, which causes it to thicken and harden up. Over time, the artery loses its flexibility, and that channel for blood flow just gets narrower and narrower. Until one day, pop, it blocks completely. Okay, we've identified the weapon, lipohyalinosis, and we've got the evidence left at the scene, that little lacune. Now it's time to connect all of this back to the patient's original symptoms from 5 years ago and see if our theory holds water. Now, check this out. The patient's symptoms back then were incredibly specific. She lost all sensation on one side of her body, face, arm, and leg. But, and this is crucial, she had zero muscle weakness. She could speak perfectly, her vision was fine. The purity of these symptoms is a massive clue. It tells us the damage had to be very, very small and in a very specific spot. And this is where it all just clicks into place. Those pure sensory symptoms, they act like a GPS pointing directly to one location in the brain, the thalamus. The thalamus is basically the brain's central hub for all sensory information. And you guessed it,
It's located deep in the brain, and it's supplied by those exact same tiny little arteries that get damaged by lipohyalinosis.
So let's just lay out the full timeline of the crime. For years, maybe decades, the patient's high blood pressure and diabetes were silently damaging her small arteries. Then 5 years ago, one of those arteries going to her thalamus finally blocked up, causing that very specific stroke. Her body then did its job, cleaned up the damage, and left behind that tiny cavity. And today, that cavity is the final piece of evidence that confirms the entire sequence of events. Case closed.
But hold on. Before we can be 100% sure, any good detective has to consider other possibilities, right? We need to make sure that no other condition could possibly explain the evidence we found. So, let's take a look at the usual suspects. This lineup really shows why our conclusion is so solid. I mean, look at the other possibilities. A big embolic stroke, say from a clot from the heart, causes a big, wedge-shaped injury on the brain's surface and would give you symptoms like language problems. Multiple sclerosis? That's inflammatory. It creates plaques, not clean little cavities. And a tumor is a growing mass. None of them fit our evidence. A tiny, clean, fluid-filled cavity deep inside the brain. It just doesn't work. All right, so after that deep dive, let's just quickly summarize the key takeaways from our investigation. What are the things you absolutely need to remember from this case?
So here's the final verdict, nice and simple. Those small cavities are called lacunes, and they're the healed scars of tiny strokes. The underlying cause is small vessel disease, which is driven by high blood pressure and diabetes. And clinically, they show up with these really clean, pure syndromes because they damage such a small, precise area of the brain.
And this really brings us to our final thought. This entire process, the hardening of those tiny arteries, it can happen silently, over years, maybe even decades, before it ever causes a stroke that you'd notice. It's just a really powerful reminder that managing long-term conditions like high blood pressure isn't just about protecting your heart. It is absolutely critical for protecting your brain.